done it
Hey
yet.
guys!
Oh, hey! How are you?
I'm good. I had a few questions though. I was thinking about taking a birth control pill.
Mm-hmm.
Do you guys know anything about that at all?
Well, yes, in fact I do. Oral contraceptives, or birth control pills, and I found this in Medline Plus, by the way, is used to prevent pregnancy. There are two hormones involved, estrogen and progesterone. The two hormones work by preventing ovulation, which in turn prevents pregnancy. And it also helps by changing the lining of the uterus, so that also prevents pregnancy. And it changes the mucus on the cervix to prevent the sperm from entering.
Oh, okay. That's kind of helpful. I also heard that you have to take the pill the same time every day. Is that true?
Yes, you're right. You do have to take the pill at the same time every day. And if you miss a pill, then you have to take 2 pills the next day. And if you've missed 2 pills, then you have to take 2 pills for 2 days in a row. So you really should avoid missing pills because then it decreases the effectiveness of the pill.
Okay. I'm going to have to set an alarm for that. Okay, so does the pill help with anything else besides preventing pregnancy?
Yeah, oral contraceptives can be also used to relieve the symptoms of premenstrual dysphoric disorder, which causes a lot of physical and emotional symptoms that occur before your period begins. It can also be used in the treatment of acne in some patients, but you have to be careful because even though the birth control pill is very good at preventing pregnancy, it doesn't prevent sexually transmitted infections.
Okay. Wow, that's really interesting.
Mm-hmm.
So, Katie, do you know anything about the pill? Do you know if it, causes weight gain?
A lot of people actually think that, but it's not the case. The effect the pill has on weight is actually quite small, and any weight that you do gain is because of water, because you retain the water.
Oh, okay. That's good, because I don't want to be putting on any pounds. I also heard that the pill increases your risk of cancer. That's kind of scary.
Well, scientific evidence suggests that using birth control pills for longer periods of time increases your risk of some cancers, such as cervical and liver cancer. But it can also decrease your risk of other types of cancer, like ovarian and endometrial. The effect of birth control pills on breast cancer isn't quite clear, though, but there have been studies that show a link between taking the pill and breast cancer.
Okay, so it's like a 50-50 shot on that one.
Yeah.
I also have high blood pressure, like slightly high. It's not too severe. Should I be taking the pill?
Well, the pill can slightly increase your blood pressure, so you should take it every day just to make sure that it's safe.
Okay. There seems to be so many reasons not to take the pill. Are there, good things about the pill?
Of course there are. When used the correct way, it's 99% effective in preventing pregnancy. And it doesn't affect your sex life, so no need to worry about that. And certain pills can also lessen your menstrual cramps and even make the cycle itself lighter. And as Katie said before, it can help clear up acne, if you have it. Which I can see that you don't.
Good. That's what I've been waiting to hear. Is it safe to use the pill continuously on your period?
Actually, yeah, a lot of women do this, and mostly it's because they're planning a honeymoon or an athletic event, or it's just to avoid discomforts like PMS. So,
Okay.
yeah.
So let's say I gave birth. How soon could I take the pill?
Well, if you gave birth vaginally, you would want to wait 3 weeks. But if you're nursing or have an increased risk of blood clots, you're going to want to wait at least 6 weeks.
Okay. How will I know if I have increased blood clots? Increased risk of blood clots.
I think I read in Planned Parenthood that some common indications are if you're obese, greater than 35, if you have a family or self-history of it, or if you smoke. So you shouldn't smoke, and also it's just good to go over these things with your doctor if you do decide to go on the pill.
Okay. I don't have any of those, so that's a good sign. I also talked to my friend who read in Perry's textbook that there are a few contraindications for it. And I just want to verify it with you guys to see if she's correct. She said that if I had a history of thromboembolic disorders, if I had coronary artery disease, liver problems, breast cancer, or estrogen-dependent tumors, or hypertension and diabetes, or that if I smoked or was pregnant. that I shouldn't take the pill. Do you guys know anything about that?
Yeah,
That sounds
that's what I
about right.
heard.
Yeah.
Sounds good.
Okay. I definitely am going to talk to my doctor, though, about this.
Yeah, that's a good
Good.
idea.
Yeah.
Okay. I think I'm going to go to Planned Parenthood right now and get the pill.
Good.
All right, sounds good.
Okay, see you guys.